Hello everyone and welcome back to my YouTube channel. I hope you guys are getting happier and healthier day by day. Today I am going to talk about some common lab tests which are done in people with diabetes periodically to monitor their sugar control and to detect associated complications and conditions at the earliest. It is imperative for people with diabetes to know about them and their interpretation so that they can take care of themselves in the best possible way and can prevent the complications by taking action timely. Please remember that this video is for educational purpose only and you must consult your treating doctor for understanding more about these tests and your individual targets. So let's start with the first test, which is fasting and post-meal sugar test. These are the most commonly done tests in people with diabetes. Fasting plasma glucose is done after more than 8 hours of overnight fasting, and the desired target is 80 to 130 milligram per cent. The postprandial or post-meal plasma glucose test is done 2 hours after last meal. But please remember, these 2 hours are counted from the time you start eating your meal. The desired target is less than 180 milligram per cent. Now, a few things to remember here. The factors which help in deciding individual targets are age of the person, life expectancy, duration of diabetes, risk of hypoglycemia or low sugar, associated conditions like heart or kidney disease. In people who are younger, who have long life expectancy, who have shorter duration of diabetes, we try to keep fasting sugar around 80 to 100 milligram per cent. While people who are older, who have shorter life expectancy, who have longer duration of diabetes, who have higher risk of hypoglycemia, we try to keep it around 100 to 130 milligram per cent. The same way, the post-meal sugar, ideally it should be kept around or less than 140 milligram per cent. But if somebody is old, he has long history of diabetes, and if he has high risk of hypoglycemia, it is preferable to keep it less than 180 milligram per cent. The next most important test is glycosylated hemoglobin or HbA1c. This suggests last 3 months average of blood sugar in body. It is the most important test to assess the glucose control in the body. It can be done at any time of the day and fasting is not required for this. If it is less than 7%, it should be done once in 6 months. But if it is more than 7%, it should be done every 3 to 4 months till the target is achieved. Now, it's very important to remember that we must individualize the HbA1c target for each and every person with diabetes. Though it is commonly said that most of people should have less than 7%, there is some difference in that understanding. So people who are very young, who have long life expectancy, who have newly diagnosed diabetes or having short duration of diabetes, who do not have any associated heart, kidney or eye problems, and who have low risk of hypoglycemia, we prefer to keep HbA1c less than 6.5%. While at the other extreme, if you see, if the person is having old age and he is dependent on caregiver, he has shorter life expectancy, diabetes duration is more than 10 to 15 years, he has associated heart, kidney or eye problems, or he has high risk of hypoglycemia, we try to keep HbA1c between 7 to 8%. While most of the other people, we prefer to keep HbA1c less than 7%, or we can say 6.5 to 7%. So the most important factors which help us in deciding the individual target of HbA1c for each individual are age, life expectancy, duration of diabetes, risk of hypoglycemia or low sugar, and associated conditions like heart or kidney disease. Next, very important test is lipid profile or cholesterol test. This must be done at the time of diagnosis of diabetes and then it should be done periodically. It should preferably be done in fasting state and 12 to 14 hours of fasting is required for this. This should be repeated every 8 to 12 weeks till target levels are achieved. Please check your individual targets or goals with your treating doctor. Now, once the targets are achieved, the full lipid profile should be done once per year. Sometimes we do check abnormal fractions like LDL or bad cholesterol or triglycerides to ensure compliance and control. Renal or kidney function tests. As you know, diabetes is the commonest cause of chronic kidney disease worldwide. So there are two tests which are important, and first is serum creatinine with eGFR, and this should be done at the time of diagnosis of diabetes and then periodically. The normal eGFR is more than 90 milliliter per minute. If the values are normal, we repeat these tests once per year. But if it is abnormal, then we do it once in 3 to 6 months. And if eGFR is less than 60 milliliter per minute, you should consult nephrologist so that he can guide you further. The next most important test is microalbumin urine. This is a spot urine test, preferably done in morning. But if it is not possible, it can be done at any time of the day. It is a ratio of urinary albumin to creatinine, and the normal value is less than 30 milligram per gram of creatinine. If it is normal, we do it once per year. But if it is abnormal, we repeat it every 3 to 6 months to track the progress and to adjust the dose of medications. Now, very important thing to remember about microalbumin urine, that we should avoid doing this test if somebody is having fever or having acute sickness or during menstruation in female, if passing blood in urine, or having urine infection, or after doing heavy exercise, because these factors can lead to falsely positive microalbumin in urine. Next is liver function test. Full liver function test must be done at the time of diagnosis. If it is not possible, at least ALT and AST should be done. Then we should repeat them periodically. If they are abnormal, we can do once in 3 to 4 months, and if they are normal, once in 6 to 12 months. Liver function tests, actually, they help us in diagnosing non-alcoholic fatty liver disease, which is very, very common in people with diabetes. Then alcoholic fatty liver disease, gallbladder diseases, and medication-related side effects. And you must consult a gastroenterologist if your liver function remains abnormal or if they are persistently abnormal. The next is complete blood count. It can be done at the time of diagnosis and after that as and when required to check the hemoglobin levels and diagnose anemia or other hemoglobin related disorders which can interfere in HbA1c test. It should be done in all females because there is a higher prevalence of anemia or low HB. If anemia is present, it should be investigated further and must be treated well. It can be done at any time of the day and fasting is not required. Routine urine analysis. This should be done at the time of diagnosis to detect glucose, protein, ketone, or infection in urine. Should be done preferably with the first morning sample, midstream sample, and must be collected properly to avoid contamination. This test is done periodically as per requirement or if there are some urinary symptoms. Thyroid function test. In people with type 1 diabetes, thyroid function test must be done at the time of diagnosis, then once per year if they are normal. In people with type 2 diabetes, they should be done if there are symptoms suggestive of thyroid problem or there is presence of thyroid swelling or if there is suspicion of thyroid problem. Preferably samples should be collected in the morning. Serum electrolytes, which include mainly sodium and potassium. They should be done if person is on some medications like diuretics or some blood pressure medications like ARBs or ACE inhibitors, which can affect sodium and potassium in blood. They should also be done in people with diabetes with kidney disease because kidney disease can affect them. They should be done every 2 to 6 months as per requirement, and your treating doctor will guide you accordingly. Then there are some other tests which should be done as per the requirement, like vitamin D. It is very common to have vitamin D deficiency, and we see very often that many people have this. So this should be done as per requirement or as per the symptoms. Then vitamin B12, if a person is vegetarian or he is on metformin for long period, then we should do vitamin B12 and it needs fasting of more than 8 hours. Uric acid, if somebody is having symptoms of high uric acid like joint aches, a past history of high uric acid, or kidney stones, etc. And CPK, also known as creatinine phosphokinase, CPK total, which we refer as, reflects muscle function and it should be done as and when required in people taking cholesterol lowering agents like statins. And if person is having severe muscle aches or muscle cramps, then this should be done. So I hope this information will help you in understanding your laboratory test more clearly. And next time, whenever you do your laboratory test, always discuss with your treating doctor to understand them in a correct way. And if you have found this video informative, please don't forget to share with your near and dear ones so that they can also be aware of these tests, how to interpret them, and they can detect the problems at the earliest and can seek the advice or seek the consultation with an expert as soon as possible. Thank you very much.